Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we have a very special guest. Her name is Megan Chilcott, and she is in a unique position in the healthcare industry. She actually is the Senior Vice President of a company called Order Insight. This is a company that provides pharmacy-related services, and I'm delighted to have Megan on our episode here today.
Thank you very much. I
Very
really
good.
appreciate it.
Thank you. Yes, ma'am. Now tell us, what state are you calling from?
I am in Nashville, Tennessee.
Okay, very good. Is Tennessee an area where there's a lot of healthcare resources that are utilized in new and innovative ways?
Actually, there is in Nashville. We have a healthcare hub. There's a lot of implementations from a healthcare perspective with technology.
Very good. And I've heard that from other people. That's why I brought that up specifically, because many people think of, Los Angeles or New York or places like that as being the innovators in healthcare. But I would say it's actually some of the other states that have different perspectives, if you will. So I have seen other companies come out of Tennessee that have done some amazing work as well. And then in terms of your role, tell us about telepharmacy. That's an article that you posted recently on LinkedIn. What exactly is telepharmacy?
So telepharmacy, I'm currently advising for a company called EasyRX, and they have a telepharmacy clinical platform. And what it allows is the patient to have face-to-face conversations, either via mobile or through their computer, with their pharmacist, so that pharmacist can see see the patient. If the patient is having a rash, they can actually show the pharmacist the rash. If the patient wants to show the pharmacist the medications while they're going through their medications and doing medication review, the pharmacist is capable of doing that. But telepharmacy is really it's a broad area of pharmacy, meaning that not only is it the communications between the patient and the actual pharmacist themselves, but there's also telepharmacy where pharmacists can remotely check prescriptions that are filled in another facility managed by, say, a pharmacy technician. So there are different areas of telepharmacy.
Okay,
very
good.
Similar to what you see with telehealth or telemedicine.
Sure. Excellent. Very good. And then tell me about the patients, who are connected with these telepharmacists. Are they being referred by their doctor specifically to a certain pharmacy to get that care, or is it from like a social worker or from a hospital when they discharge the patient home?
Generally, with the telepharmacy services, those are provided by specific pharmacies. So if the patient happens to have a pharmacy that utilizes that technology, then they have it available to them. In rural areas where there may not be pharmacies readily available to the patient, then the doctor may refer the patient to a pharmacy if they feel that it's a good fit. But generally, it would be from the patient's primary pharmacy that they would go to.
I see. Very good. And in terms of numbers, do you have sort of a rough estimate of how many thousand or how many million patients may be accessing telepharmacy, let's say in a typical year?
I don't have any numbers regarding it. It is a fairly newer technology. We've just seen it within the last couple of years, where, just the same that we've seen with telemedicine, it takes a period of time for the patients to feel comfortable with it, in comparison to how they're used to dealing with their pharmacist on a normal daily basis, of going into their pharmacy or calling via, talking to them over the phone.
I see. Excellent. Very good. And then the app that you mentioned, the EasyRX, is that something that people can download on their own devices, or is there some special equipment that they need in order to be connected?
No, actually, it's really simple. They can actually download it right from the App Store. But their pharmacy would also have to be, connected with the EasyRX platform in order for them to have that communication.
Okay.
So if a patient is interested, they could always bring it, mention it to their pharmacist, and our pharmacist can sign up for the service.
Excellent. Very good. And then tell me about the outcomes with telepharmacy. Is this designed to prevent errors? Is it designed to increase compliance with medication? What have you seen based on your research?
It's designed to increase compliance with medication and to have a more personal touch with the patient. And especially pharmacies have been doing this for years, and mail order pharmacies trying to manage the patient in a way that even though they're not going in and visiting their pharmacist and seeing them face to face, that they can still have those same conversations and feel comfortable with their pharmacist. What telepharmacy is actually doing in these types of apps and services is bringing that back, where they can still see their pharmacist and know their pharmacist if they don't have the capability of physically going to the pharmacy to see the pharmacist.
Wow, very good. And then have you seen some, I guess, resistance or any barriers that were kind of unexpected when you rolled out these types of platforms?
There are some barriers. From the remote pharmacy perspective, telepharmacy, some state board pharmacies still have to approve the technology. I know, like, for example, Louisiana allows for the pharmacist to do the remote checking of prescriptions utilizing telepharmacy technology. But it's something that we still, from a regulatory perspective, have to really push our states to allow. The communication part with the pharmacist to the patient is it's perfectly okay. I mean, the technology is there. The pharmacists are able to do it as long as they have the technology in their pharmacy.
Excellent. Very good. And I will say that some of the very large players in the industry, people like Amazon, Citibank, JP Morgan, there have been several articles I've read about in medical journals as well as in the mainstream news that they're actually trying to develop or disrupt the way the healthcare system is actually working now. So it almost seems as though they want to bring more of this type of telepharmacy directly into the home or even the workplace in order to eliminate some of the brick and mortar pharmacies. Is that a trend that you have seen, or what kind of feedback have you gotten from people that you know in the industry?
Many years ago when the mail order pharmacy started, we thought we were going to see disruption and that the brick and mortars would go away. I don't think the brick and mortars will ever per se go away. What I do think is that companies like Amazon are going to have the strength and the resources to push these types of technology so that customers feel comfortable with them. No different than they have with other delivery services, such as delivering your packages inside your doors. I mean, a few years ago, that would have been nonsense. But I think bringing Amazon into the pharmacy space is going to open up people's eyes and see that there are different ways of practicing pharmacy.
Absolutely. No, I agree with you 100% on that. Sometimes the ideas that people come up with, they brainstorm and they come up with something so crazy, you would think, why in the world would people do that? And then 2 or 3 years later, that's actually what people are doing without question. So I think there's a lot of role with technology where it's accelerated so quickly, where people will take simple technologies that may already be available and just kind of innovate them, kind of match the market that they're looking for. And do you have some final thoughts for us? Any ideas or thoughts that you would like our listeners to be aware of with telepharmacy or your industry in general?
I think from the industry in general, we have a lot of exciting things coming ahead of us with analytics and artificial intelligence. The industry is ripe for disruption, and there's a lot of companies out there, a lot of startups that are actually looking to change the way that pharmacy is practiced.
Excellent. Very good. And hopefully it's for the betterment of, healthcare in general, because right now it's so complicated. And every time I'm an ER doctor, I write a prescription, I send people to the pharmacy. About 50% of the time I get a phone call back that either the medication is not covered or it's the wrong formulation or the patient just isn't able to get it that day. And so I agree with you. I think we need to actually kind of look at the way that we're doing things badly, and then hopefully we can improve on that for the betterment of patient care, certainly. Well, thank you so much. You've been listening to Megan Chilcott. She's been our guest today. She is the Senior Vice President of a company called Order Insight. This is a leader in telepharmacy services. Download that, talk to your pharmacy, and see if that's available for you. Thank you so much again, Megan, for being a guest today. We really learned a lot from you. You've been listening to Simple Health Radio with Dr. Emran. Follow us on social media, including Twitter. Your ideas on Facebook, Instagram, and Pinterest. And I look forward to having you on a future episode.